Kapare Guam, and welcome to KOM News Extra. I'm Sonia Artero. Nurses Month is celebrated nationwide during the month of May. And because being a nurse is both a profession and a passion, we've asked a group of nurses to share the positive side of their profession. In spite of Guam's shortage both in nursing staff and faculty, the Guam Nurses Association maintains the highest standards of nursing and health care. Here to elaborate on a profession that takes compassion is Maria Solomon. She is the president of the Guam Nurses Association. Maria is joined by the University of Guam's Director of Nursing, Lillian Perez-Posadas, who also chairs the Guam Board of Nurse Examiners. Ladies, thank you very much for coming on tonight.
Thank you.
It's our pleasure to have you. Now, Maria, as a professional organization for nurses, how does the Guam Nurses Association represent all nurses on Guam?
The Guam Nurses Association was created in 1968 to represent nurses in Guam. And as the organization for nurses, we promote the standards for the nursing profession, practice and education, and we offer continuing education for nurses to improve them while in their practice and to promote professional development. We also advocate for issues that are related to salaries and working conditions, and we promote legislation that strengthen the profession and improve health care, among other things.
Now, I understand the University of Guam's nursing program is accredited by the National League for Nursing Accrediting Commission. Now, can you tell us why the program has specific accreditation and why it's so important and what it should mean to our community?
Accreditation is a benchmark or a standard by which the quality of the educational program is evaluated. And so it means for us that if the program is accredited, we are producing quality graduates who become nurses, whether in Guam or anywhere in the U.S. or actually anywhere in the world, because our program has very high standards. And we are also evaluated on the number of graduates that we produce and are passing in the licensing exam for nurses. And at this point, our passing rate has been above 90%.
Fantastic. Lillian, UOG just launched an associate degree in nursing in fall of 2006. How does the new program address the needs of the students on our island?
Actually, with the associate degree, the University of Guam program started out with an associate degree, and then it kind of advanced itself to a baccalaureate level of degree, and that was part of the push from the National Council and the national standards that, nursing education will be now, the minimum will be baccalaureate degree. But because of the demands and the shortages of nurses in Guam and throughout the nation, associate degree programs, you're producing nurses at a quicker rate, quicker turnaround, because it's only a 2-year program, curriculum, but you do confer an associate degree, and they still qualify to then take the national examination to be licensed as a registered nurse. So for Guam, I think it will meet the demands and the needs for registered nurses throughout our community, particularly the hospital. Public health also is still experiencing shortage of nurses, registered nurses. Mental health is experiencing shortage of nurses. So, with those 3 big agencies lacking registered nurses, the UOG Guam reinstituting the associate degree will help hopefully resolve those shortages.
How do you appeal to high school students to encourage them to get into the nursing program? What do you say to them?
Well, what we need to do is make the profession of nursing a positive. From what they've seen in the past is that, it is a demanding job. It's a lot of work. It is hard work. But, really what you do to make a difference in people's lives is really what matters. And, you give a lot of compassion to it. At the same time, you're needing to know what those pathophysiological conditions are of the patients and what the medications that you're administering to the patients, and with all of that, you're making a big difference in people's lives. And you apply what you learn as a nurse, not only in your work setting, but in your own personal life.
I know nursing takes a lot of compassion. It takes someone who's actually patient, but there's also people out there who have those qualities but also want to be paid as well. Where is the pay scale? Where does it start, and how high can you go? How do you attract people with the pay?
that's one of our challenges because, you know, a lot of our agencies that employ nurses are government agencies, and we're guided by those regulations, and how the salaries for nurses are established is we follow the government process. And we've been very fortunate in the last years that the salaries for nurses have been raised. And so in some areas in the United States, we're pretty comparable to the salaries of nurses. And, you know, you work many years and you certainly can earn a very good income. And the profession of nursing is a guaranteed job. You really, anywhere you can go. And you can launch off, you know, and you don't only have to work in a hospital, you can even open up your own business. You know, with that education and with that training, you can certainly open up your own business, become an entrepreneur.
Now, for high schoolers, to ensure that they do get into the program, what steps should they be taking in high school to you know, be considered?
Do you want to answer that, or
Sure.
since you're in the academia?
We want to encourage high school students to start preparing themselves for developing good study habits, especially excelling in courses such as sciences, biology, chemistry, and math and English, because this will be needed when they come to the nursing program. It's a very challenging program, but it's doable, and students are encouraged to go into nursing because they want to be nurses, not because their parents want them to be, and stay motivated and just look forward to graduating. We see students coming in, their eyes are bright, they're eager to learn, and then they mature very quickly through the program, and then they come